Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Thank you, and I know that every time that I come on, we promise you a unique perspective on healthcare, okay? And sometimes what that means is that we have different people looking at things from different ways. Today's perspective, by my own definition, is going to be truly unique. My guest is Mike Fenster. He is known around the world as Chef Dr. Mike. He is an interventional cardiologist. He is a professor of culinary medicine located out in Montana. He is a member of the baby boomer generation. Chef Dr. Mike, welcome to the podcast.
Thanks, Rob. Thanks so much for having me. I'm absolutely delighted to be here, and I'm all about these unique perspectives, so I'm really excited.
You bet. So tell me a little bit about yourself and your role in healthcare, please.
Sure. My role in healthcare actually went through the restaurant industry. So I started as a dishwasher in college to help pay for college, get through college, and worked my way up to what we call today an executive chef. As you mentioned, I'm on the other side of the age bracket there, and back then there wasn't such a thing outside of Julia Child and maybe Graham Kerr from New Zealand in terms of this celebrity chef phenomenon. Certainly no Food Network outside of Julia's show. So that was not a glamorous occupation, washing dishes and cooking in the kitchen. Went off to medical school and became an interventional cardiologist, but always kept that love of food and the food experience that was such an integral part of my childhood growing up, and obviously part of a professional endeavor as well. Actually did go back and get my culinary degree, and lo and behold, they say the way to somebody's heart is through their stomach, and that's all about my approach to culinary medicine.
Okay, so it's funny to hear you say that. You're a cardiologist, and the idea of the way to the heart is through the stomach. What was it? Was it a gradual realization? Was it like an epiphany? What was it that you woke up one morning and said, you know what I have here are not two separate worlds, but they're actually the same thing. How did that realization happen?
I think probably for a lot of folks, I had a personal health challenge. So in my youth, I thought I was a great college athlete. In retrospect, I wasn't, which is probably why I broke all those bones and joints and tore ligaments, etc., trying to be that which I was not. And like many things in life, those bills come due as you get a little bit older. And, I was presented, and I grew up eating great food. My mom was a great home cook. We went out. I knew about sourcing. As a professional chef, I know about sourcing real ingredients, etc. But I got away from that, right? Life gets crazy. I was an intern, a resident, and a busy interventional cardiology fellow, and then, in practice. And so, I was practicing the convenience lifestyle. Drug reps coming by, bringing, whatever they picked up at the drive-through for us, having, 18 cups of coffee and 24 Diet Cokes to get myself through the evening, and then on call, just not the best situation. And then it turns out I was confronted, with a surgical option. And I was like, holy cow, I am still too young to be able to do this. And the doc was like, you should have had a surgery, about 5-10 years ago. And I was like, well, let's hold off on the joint replacements and let me see what I can do. And so I did have a surgery where they debrided and they kind of cleaned out the joint. And I sought a second opinion. They told me the same thing. And they actually told me I would need 2 joint replacements within the next couple of years. That was over 15 years ago. And the way I approached it was I was like, I know this is an inflammatory process, much like cardiovascular diseases, much like diabetes turns out to be. What can I do, to address that? And I got back to my roots. I was like, I can control what I eat, and really got back. And as a chef, I had the advantage of creating these really delicious foods from wholesome ingredients, and then started looking for the data to support all that in the literature. And sure enough, it turns out now, these decade plus years later, that's exactly what the science is showing us, is that we've manipulated our foods in such a way that that's a major contributor to the chronic low level inflammation that seems to be at the root of so many of the current healthcare challenges.
Understood. What does quality healthcare mean to you?
Well, quality healthcare, really means putting the patient at the center of the equation. And to give you an example, I gave a keynote address talking about culinary medicine at a medical center not too long ago, this fall. And immediately all the healthcare professionals who were there, and a wide range of them, started talking about what we can do, and we're going to get this perspective, and then we can tell the patient this, and we can tell the patient that, and we can write this food prescription for the patient. And my question was, I listened to it for a couple minutes. I was like, nobody talked to the patient, right? So as a culinary person, one of the great joys of my life is food and eating the food that I love. And we know that makes us happy, and we know that that has health outcomes, right? We know depression is a major risk factor, as important as any cholesterol level in terms of cardiovascular events. We never tell people do things that make you happy, right? It's take the cholesterol pill, take the diabetic pill, etc. And so, in talking to the folks there at that meeting, I was like, well, what about the patient? What about the people that they eat with? You're going to prescribe all these things. What if they hate seafood? What if somebody's allergic to tree nuts and they can't incorporate nuts because their spouse, their partner, etc. So, I think quality healthcare, it comes down to, as you and I spoke earlier, some individual choices. And so we have to incorporate that individual into the decision-making process and not simply be the parent, the patriarch telling them what to do, right? Like they told me, you need to go get a surgery. Well, maybe I do, maybe I don't. Turns out, I don't. And I hike the mountains of Montana, for 8 hours. I can't go jogging. I can't play basketball because of the high impact, but I can certainly do a lot of things they told me I wouldn't be able to do. And so I think that's one of our focuses on culinary medicine. It comes down to that individual's relationship with food, and then a broader context of quality healthcare. We've got to start incorporating the individual.
Okay, I love what you're saying there. You're preaching to the choir on that, and so you answered the next question. The next question is about giving an example of quality healthcare, which you have done. And let me just point out one other thing while we're here. I've got a very good friend who is a chef, and went out to different restaurants with him, and his delight was to get the chef to do like a chef sampling platter or something in which the chef made their specialties and shared them. But every time he did that, the first question that the chef would ask is, does anybody in your group have food allergies? Or they immediately took it back to, this is about me, and it's about what my specialties are, but I need to make sure that it's about those that are enjoying it as well, that I'm matching the food to them. That to me sounds like exactly what you're talking about with the conversation with the doctor. It's not a one-way street in which I now tell the patient. It's a conversation in which here's where we need to go. Let's talk about how this fits into your lifestyle and into your world. Does that make sense with you?
Oh, absolutely. And I agree 100%, right? When we're talking about food, we're talking about something that parallels the history of humankind and the evolution of our species. A great book by the Harvard professor Richard Wrangham called Catching Fire that was out a couple of years back. And he makes a very good argument that we're only really a species as we know it today that has come to dominate the planet Because a couple 100,000 years ago, somebody decided they were a chef and like cooked mastodon burgers for the rest of us, and we all gathered around the fireplace and said, "Yeah, man, we are in on this." And you look at the how the history of food has shaped the development and the history of humankind. And then I would say, look at your own life. Our own food experiences are such a part of the events. Food and the food experience, it's not like, telling somebody, hey, you need to exercise. Maybe somebody exercises, maybe they don't. Or, drinking wine or having a cigarette. Maybe you do, maybe you don't, maybe you can avoid it. Everybody's got to eat. That's the thing that binds us as human beings on this planet, and why it's been such an important construct of the social fabric. So when we talk about dietary decisions, we're talking about, our own personal choices, the things that give us pleasure. It's a relationship we have with food that is also intimately connected to our other relationships with each other, and by extension, actually our relationship with the planet. So it's a foundational piece, as we like to say in culinary medicine. From the moment we bond with our mothers over breast or bottle, that food relationship starts to define us. And so it is absolutely critical that this be something of enjoyment, be a point of happiness for us in our daily existence, and then something that we use as a relationship to interact and share with each other. And the reason that that's important from a health perspective, because if we look at things like the Blue Zone studies, which is the National Geographic work of Dan Buettner, where they've gone around the globe and looked at areas of the populations where there's not only an excess of people, statistically speaking, over 100, but these people are functional, they're very healthy, they're vibrant, they've got cognitive function, etc. When we look at the results of the Harvard Happiness Study, which has followed people now out over 80 years, and asked a very simple question: what correlates, when we look at all the variables, to health, longevity, happiness, etc.? Is it money? Is it social status? Is it, these sorts of things? Is it your cholesterol level, right? I'm an interventional cardiologist. The answer is it's none of that. It's the quality of the relationships in our lives. As the founder of the Harvard Happiness Study, which is actually two studies, the Grant and the Glueck studies, said, it's basically about love and happiness, full stop. And so food is one of those focal points upon which we build those experiences. And so it is absolutely critical that it be about the happiness of the individual.
So there are two things that I'll just mention here that I've learned from the community here in Pittsburgh. One of them is one of the advocacy leaders here, Sally Jo Snyder, has told me that if we don't eat, we don't meet. Food is what brings people together. Another, Dr. Al Condalucci, who is all about social capital, had taught me that it's hard to to be angry with people with whom you have broken bread. So when you sit down and have a meal together, it actually builds relationships. What do you wish people understood about your role in healthcare?
I wish that people would understand that, as you and I spoke earlier, there is no salvation in deprivation. Because as soon as the conversation starts to talk about people have this view that it's about depriving themselves of things. It's about not enjoying, and it's actually the exact opposite. So it's about creating that positivity, and it is, there are a lot of challenges. One of the simple things about our culinary medicine approach is that it's really based on a foundation that's evidence based. So the data is out there in the studies about moving away from ultra processed foods. At no time in the history of humankind have we been eating so much food in which we destroy the food and try to put it back together as happens in ultra processed food. And we and the 100 trillion bacteria that constitute our gut microbiome have not evolved to eat those sorts of things. So it's not a leap of logic to assume that might upset us a little bit, and we get out of balance. When we get out of balance, right, we're in a position of dis-ease, hence disease, that arises from all these things. So the solution does require a little work, but it's not complicated, and it does unfortunately, affect some major players in terms of those who influence and want to control the dialogue about our health and the food we eat.
Okay. Uh, what excites you about the future of healthcare?
What really excites me is, how delicious it can be, and I mean that in every sense of the word. So, part of my journey back was recapturing the joy I had in experiencing the real food and reestablishing my connection to, as a chef, where my food comes from. And so that's, a connection not just from the farm, which is, I think, a little bit of its own, but to the very soil and to all those people who produce it, for me. So, again, I talk about, the diet of things you want to eat. So there's a lot of plants, but it's not plant exclusive. So I'm down there visiting the guy who's raising, my heritage, what would be organically produced, pork. Once a year I go out there, hello pork chop. The year I'll see you in the fall, and honoring him and those things. And it's these connections again through the food we eat, and as you just said, then sharing those experiences with each other and this positive, direction of creating good health and wellness that's not sort of what I experienced as an interventional cardiologist in the hospital, which was, sort of depression and disease. So I've been doing interventional cardiology for a long, long time. And now, I still do that, but I also teach culinary medicine at the University of Montana. And what I get excited about is the positivity and the joy at this point in my career that I can experience with people. Certainly, going in at 2 a.m. and working on someone and reversing what would be a fatal condition is very rewarding, but it's awful frustrating to see them, miserable and handicapped, by the things that they can do and the things that they can eat and the things that they can experience, months later. And here, maybe I get to prevent that. According to the American Heart Association, 80% of heart attacks are preventable.
Yeah, a startling statistic.
Yes.
What is one thing medical professionals can start doing today to improve the quality of healthcare?
They can get online and take the Introduction to Culinary Medicine course from the University of Montana. We offer that online because, in many phases of healthcare, we talked about putting the patient at the center. It's not that we're necessarily doing a whole lot of things differently, but we're changing our perspective on that reality, and that opens up new doors and new possibilities. And culinary medicine is about shifting our perspective, on this food health relationship, putting the individual back at it. So, I think that in a way, it's kind of contagious. So the physicians, in a good way, going viral, but not in a COVID way. It's about, for the healthcare professionals, nurses, the PAs, the physicians who've taken the course, that this seems to influence their general approach to medicine and healing. And we become less about a pill for every ill and more about all those modalities that we have, that affect, our health and our wellness. One of the things that we look at in culinary medicine that would be not be a traditional kind of nutricentric or nutrient focused approach is how we eat food, right? But if we look at the data set in terms of mindfulness, meaning, how we sit down to a meal, who we share it with, what we focus on, and particularly the data from things called MB Eats or mindfulness-based eating awareness techniques, what we find is that actually can measurably reduce our markers of inflammation. Wow. So you talk about how I feel and how I approach and how I enjoy and engage whilst I eat actually can affect my immune system in terms of inflammatory modulators. wow, that's pretty powerful, and that's pretty powerful and empowering, for the patient as well.
Okay, and what I'm hearing you say is it's not just what you eat, but it's how you eat it and whom you eat it with, and all of those things, which is a very fitting way to end our podcast today with that understanding that it's a holistic thing. You're looking at the individual as a whole. It's not just the symptoms that you're treating with pills, but it is their entire lifestyle, the entirety of what they're doing, from what they eat to, as we just said, who they eat with, how they eat, all of those things. Wonderful. Listen, Chef Dr. Mike, thank you so much for being with me today. I promised them that they would get a unique perspective on healthcare. You did not disappoint, and I appreciate you sharing your perspective on healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.